lumbar facet syndrome rehabilitation is performed first by polishing the lumbar facets, grabbing a single leg, the other knee is bent to relieve the pressure on the spine. Bring the knee up until you feel at the level you feel the affected segment move, and then lightly polish it. Comfortable position, comfortable short range of motion, comfortable tension, doing it until it feels better. Then you perform the other leg as well, bringing it up and lightly pumping. Then you bring both knees up, bringing it up to the level to where you feel the affected tension on the affected damaged facet joints, and lightly polish the facet joints out. Then feet are down. The most important exercise you can do to relieve pressure on the lumbar facet is abdominal strength. The pelvic tilt, where the patient tightens up the stomach muscles, smashing the lumbar spine into the, or pushing the lumbar spine into the table. Tighten, but notice, not too fast. Tighten, tighten, flex, flex. Notice the chest is not coming up. It's mostly a pelvic tilt coming from here, where the patient is tightening the pelvis and not coming down in a crunch. The next exercise is performed by opening the legs, grabbing the buttocks with both hands, help assisting lifting. This has got to be very careful, because in acute lumbar facet syndrome, as soon as the lumbars engage, there's going to be excruciating pain. This we don't want to happen. So as long as you only raise the buttock up to comfort level, sometimes the patient won't even be able to raise the butt up at all. So the patient lays flat and just squeezes the buttock, trying to squeeze the muscles of the buttock and the low back. For every action in life, there's an equal and opposite reaction, and as much as they can squeeze those muscles to fatigue without pain, the muscles will correspondingly relax. The patient then turns over, or the patient then turns on their side, straightens the bottom leg out, grabbing the upper thigh with the lower hand, tightening the stomach, bringing the knee up, dropping the upper elbow back, tightening the stomach, tractioning open the lumbar damaged facet area. The patient then turns on their side, sits up, and finds neutral position and sets the SI joint and aligns the discs of the body by coming forward like they're going to pick up a box, push in, knee out, hand lift the chest to neutral, squeeze the butt upper back, and then stands down from the table. You can step down from the side. There you go. Very good. The most important muscles that you can work for a back facet syndrome are the stomach muscles. A standing over the door abdominal crunch is very helpful, but the most important exercise is the belly button tucks, where the patient takes the belly button and pulls it in to the spine and up. This relieves the pressure of the facet syndrome. Recommended doing 100 belly button tucks before you start the day, even getting into the shower. Throughout the day, every time you feel your stomach out, pull the belly button in 2 or 3 times and keep it there until you realize your stomach is hanging out again. And that concludes the rehabilitation of the lumbar facet syndrome.